Hello and welcome to Newborn and Beyond. My name is Leslie Ann and I'm a qualified health visitor here in the UK. So today we're going to go through what we normally term as a new birth contact. So I will talk through what would usually happen, okay? So usually before we come out to visit you, you'll have a phone call confirming your address and confirming that you have a red book, which is the little handy book that we have at the new birth. So an appointment will then be made by your health visitor who would confirm a date and time with you, which is between day 10 and day 14. Hopefully it's sooner. So if it's between day 10 and 4 and before day 14, it's a lot better for us. Yes. So at that visit, your health visitor will attend your home, introduce herself to the family members, then she would proceed to discuss or give you information about her role and what she will be doing for the family, i.e. the support she will give the family. So we will then talk about her role. So the health visitor will be telling you her background, i.e. so I'll go from myself. So my background is in surgical nursing, and also I'm a midwife, and then I qualified as a health visitor, which is a specialist public health nurse. So our role is about making sure that the health and well-being of the family, so it's the entire family, primary family, so mother, father, and or partners, we would then be looking at their health and well-being and the health and well-being of the baby and or any siblings involved as well. So we will start with the red book and go through what we'd ask you to do with the red book. So we would look at, did the baby have what we call a NIPE before leaving the hospital? So the NIPE will be the assessment from head to toe that the doctors or qualified midwives who do NIPEs would be. So it's a neonatal examination of the child on discharge from hospital. That's one of the things we would look at in the book, because we then want to know that this baby was fit and healthy at discharge and there were no concerns. So we would then go through the red book. So the first thing I tend to do, after looking at the NIPE, would be putting my details in the red book. So I need my parents to then contact me if they have any concerns. So I would proceed to put my name and my details in the red book, which would be on the page 1 of the red book. Yes. So there's a little box at the top where, so page 1, my name and details would go here. You've got lots of details that you can put in for your GP, your midwife, also the baby's name given now, as baby is official. What name have you given baby? Baby's date of birth. And then I'd also advise you to put either parents' details. Yes, either parents' details. So both parents' details would go here. So you would put the name of both parents. Okay. So then we would go from there. We would be talking about what checks have been done so far. So has the hearing screening been completed in the hospital? If the hearing screening was not completed in the hospital, then that hearing screening, there's an appointment that would occur in the community. So it would be a referral that you would get, an appointment, and you would attend for the hearing screening. The next thing that we would look at was the blood spot done, which is a heel prick test that all babies have. We will ask if that was completed. If it wasn't completed, or if the results wouldn't have come by then anyway. So the health visitors are the ones who have access to the blood spot results or the heel prick test results. So we would have checked before we come in to see you. And if the results are not there, we will wait another week. We'll let you know what it is. However, you should receive a letter from the lab with the results. Okay. So then we would talk about what the journey was for mum during the pregnancy and during the labor and then postnatally. So was the pregnancy what we called normal pregnancy? Was there any concerns? If it was a straightforward pregnancy, what was the labor like? How long did the labor take? Was there any complications? Were there any concerns? This will then dictate how we would then manage the care that we give to that client, i.e., how often we would then see that parent. Yes, we would then look at if there was any wounds that we need to talk about. We will then talk about some wound care. Not all health visitors talk about wound care. Because my background is in surgical nursing, I do talk about wound care. So we'll look at, is the wound uncomfortable? Is there any pain? Are you concerned about your wound? I always advise to have a look at it. So if it's a cesarean wound, I usually ask to have a look at it. If it's a perineal wound where you've had an episiotomy to then deliver baby, I would usually ask to have a look at that wound, because if there's any concerns about that wound, I will then ask mum to have a look at it, then note down what she's seeing normally, and if there's any changes, then she would need to contact the GP for treatment. We would then talk about mum's well-being in herself. How is she feeling? Are there any concerns with low mood? If there's no concerns with low mood, we would then move on to how she's feeling about baby, how she's feeding. Is she breastfeeding? Is she given formula? Are there any concerns about breastfeeding or giving formula to her baby? So we would then look at the breastfeeding. If there are concerns with breastfeeding, what's the concern? Is it latch, positioning? What are the concerns? And we would then go through and look at that. Is there any tongue tie for the baby, which would then obviously impact on breastfeeding? We can then signpost to the breastfeeding cafe, which we will then do at that point. We'll either do a referral or ask mum to attend a drop-in session to be seen by the lactation consultants at the cafe. So we would then do an assessment of the baby after looking at mum. Yes, we'll do an assessment of the baby. How is the baby feeding? We'd look at the baby's skin tone and color. We look at baby's eyes. Is there any jaundice? If there's jaundice, has the midwife actually checked the baby? Because bear in mind, we're still in the first 10 days, and the midwives will still be involved. And they tend to refer to the clinics if they need to. So examination of the baby. So we will start by looking at the color, tone, skin. So we're looking at the color of the skin. If there's jaundice, the midwives will still be involved, so they will do an assessment. They've got a machine that they use to check the tone. We tend to look in the light and press on the baby's skin to see whether or not we can see any jaundice. We will then advise as to treatment. Or the midwives would have probably referred the parents back into the hospital for treatment if needed, or to just check the levels. We'll then look at baby's skin. Is the skin dry? What are we using on the skin? So a lot of the times we say to parents, only water and coconut oil. There are times when we go into a visit and we've asked parents about what we're using on baby's skin, and they will say olive oil. We have stopped using olive oil in baby's skin for several years, and we advise only using water to wash and coconut oil to moisturize, and that can be used from head to toe. So we'll look at the skin. Is the skin dry? Obviously, because we've wiped the baby clean after birth and taken off that lovely vernix and the lovely, which maintains the baby's skin from, protects the baby's skin from getting dry in the womb. And we wipe it off quickly after birth. So the baby's skin tends to be quite dry. So this would be the routine. Moisturize the skin, and then use the coconut oil to then keep a layer of moisture to the baby's skin. Okay, to prevent it from the baby from getting dry. So the skin, we look at baby's fontanelles. We look at, is baby fontanelles is soft, or is the baby's fontanelles swollen, or is the baby's fontanelle sunken? Now we can see different things by looking at the fontanelle. If it's soft and normal, we expect that's quite good. We're looking at the baby's fontanelle is sunken. We know that this is because baby is dehydrated. If the baby's fontanelle is swollen, there might be something compromised that might compromise baby. So we advise to take the baby to hospital in the two instances that the baby's fontanelle is sunken or it's swollen. So we would then look at the baby's cord. What does the baby's cord look like? The baby's cord should be dry and drying to heal. If it's moist and if it has an odor, so if it's malodorous, we'd expect that you would make sure that it's nice and dry. We'll have a look and we'd advise you on cord care. So the cord care would be to clean with cool boiled water. If you're breastfeeding, we would advise to dry with cotton wool and then put some breast milk on. If you're formula feeding, we'd advise to just clean with cool boiled water and make sure you dry, and it needs to be dry, properly well dry, okay? Because if it remains moist, then it can lead to infection. So we don't want that. We want the cord to be nice and dry after you clean it. And you wipe over once with the cotton wool and you would discard it, and another again with the cotton wool and you discard it, and then make sure it's nice and dry. So after we looked at that, we will look at the output, babies weeing and pooing. So babies have been weeing in the womb, so that's quite normal for them. Babies poo is totally different because they only started pooing on exit, so on being born. They've had their first meconium poo, and so for them, it's basically waste they're getting rid of that they've retained in their stomach throughout the pregnancy. So they're getting rid of all that waste. So, and then too, they've got storages of brown fat under their skin. They'll get rid of that waste also. So we'll expect by day 5, because the breast milk has now been established, the feeding is well established, we'd expect the poo to now be a mustard color and not the meconium that you had at day 1 and day 2. We'd expect that to change. So if the baby's poo has not changed to mustard, then we would advise you to seek medical advice, okay? So it should have been changed to mustard because the feeding is well established and the poo changes color. And we would expect lots of it. Yeah. So after we've looked at the baby's skin tone, color, we talked about feeding, we talked about poo. We now are going to do the baby's weight. So what we're looking at, the baby's weight at birth, and by this time the baby should have reached or attained the birth weight. If there was any loss at all during the first few days, by day 10 we'd expect the baby to have regained that weight. If the feeding is going well and there are no concerns with the feeding, then the baby should have maintained and increased well past the birth weight. So we will weigh the baby. The midwives, if the midwives are still involved in the care, they will also have been weighing baby also. So we can see their weight gain as the baby has gone on, or if there are any concerns with the weight at all from the midwives, we can see it, what's recorded in the red book. Again, that's recorded in the weight at the back of the book. Okay, so it's recorded here in the chart. And then we will go on to the graphs and we will record the centiles of the child, okay? But all the weight is recorded, so the midwives can record the weight, and then we can see if we need to then implement any changes in the feeding or positioning of the baby for feeding. So we have gone through mother's well-being, we've gone through the baby's weight and well-being, and then we also talked to fathers. So during the contact, sometimes the fathers are there. So if they're there, we'll ask them about their well-being also. How are they coping? This is a new, this is a massive change. It's a new role, and it's a role that they've now taken on that will last them now till. So we usually ask about how they're coping. Have they got any questions? Have they got any questions about how do they support mothers who are breastfeeding? we talk about, their well-being. If there's any mental health on either side of the family, we will then manage our care to suit. So if there's mental health in the family, i.e. the father's got mental health or the mother has mental health, what we tend to do is to then do a 2-week follow-up visit, so that we are able to then see what support we can then put in place if needed. And by us being there, we are able to then see and implement at an early stage if needs be. So referrals to our teams, i.e. perinatal mental health, or other services that have service for people who have got mental health illnesses or anxiety. There are a lot of services out there that gives, dance classes or meditation classes, anything like that we can refer on to. We also refer you to the children's centres, because the children's centres are, we work hand in hand with them. So we'll ask you to register your babies at the children's centre. So as the child gets older, there is places for the baby to go to, so that you are not isolated in your home. There is things out there for you to be doing if you did not attend one of the antenatal groups. So you can go out with your baby to one of the sessions that is led by the children's centres. So there is lots of mother and baby classes. There's baby massage, baby yoga you can find. There also has some osteopaths. So babies who've been born by von Sus or forceps, they can be seen there as well. So we will then manage the care. So if we're going to come in a follow-up 2 weeks, we will say to parents, we will do a 2-week follow-up visit. We will then send you an appointment, or sometimes we can arrange an appointment there. So at the back of the book, where we would then note down our information. So we would note down anything that we have done through the visit, which is on these pages. We will note down what we've done through the visit. We will also ask you, because I tend to ask the parents, anything significant that occurs to your baby, i.e. cord fell off day 10 or day 8. Whatever you want to put in there, you can write in there. So cord fell off, clean, no concerns. If there was a bit of blood, you can put cord fell off, bit of blood, dry blood, no concerns. We'll talk to midwife. And so you can write in the book as well. No matter about the pages, we will put the pages back in. So if we can go through the red book, and I'll show you a few things that we do. So we've gone through the front, so we can talk about the birth details in the front of the book. We talk about where the health visitor puts her details, and then we've talked about the first birth examination. We talked about the blood spot. So we have a bit where we talk about family history. If there is any conditions that is in your family, we will ask about that. So one of the things that we come across quite a lot when we do the new birth is babies who have been given formula, or they're breastfeeding and they are maybe having a bit of reflux, or a bit of they're having colic. So we would advise, if the baby is breastfeeding and mother doesn't have any allergies to cow's milk protein, we would advise her to maybe step away from dairy for like a week at least, to see if there's any change in the baby's feeding. Yeah, so we would talk about that. So in the history, we would ask about whether or not there is asthma, eczema, allergies, and anything like that that would be of significance to that child, and that would be recorded. We would go along to seeing the vitamins and multivitamins. So babies are all given vitamin D from birth. So we would talk about vitamin D as well. The first immunizations is important. So we will go through the first immunizations. You have the immunization schedule at the front of on page 18 of the red book. So we will go through that. So it's at the front of the, where you would record the immunizations, yeah? So it would be just at the front of that. Okay, and all the immunization, primary immunizations recorded here. If baby is due from an at-risk country and due BCG, that would have also had been given. So we'll go through the screening. So the first screening would be the new birth contact. With the new birth contact I've just gone through, and so which we are doing at present. And then we would go through the newborn screening. Again, has that been completed? We've gone through that as well. And then the next thing from that would be the 6 to 8 weeks contact. Now, at the new birth visit, you will be advised to register your baby at the GP, to register your baby for the birth certificate, and to ensure that you have got an appointment for the birth certificate. The reason being, because there can be logistics on the, if you don't book in time, there might be a fine. So registering at the GP, there's a need to book 3 appointments: the mother's postnatal appointment, the baby's developmental review, and the first immunizations. And these are all recorded when the baby goes to the GP. So the health visitors do their own 6 to 8 weeks screening as well. So the health visitors would have already given you an appointment for that, for their review, but you'll have to book at the GP for the 6 to 8 weeks review and the first immunization and the postnatal check for mothers. So at the postnatal check for mothers, they will do your full screening the same way they'll do the baby's full screening again, and then weight, length, head circumference, and then first immunizations. Okay. Then at that check, we'll also ask if there are any concerns. If there are no concerns at that contact, we will then see you. So sometimes I tend to advise to parents to come in at 4 weeks when baby is 4 weeks to come into clinic. The reason being, if there are any concerns with weight, is there any concerns that the parents have, they can then talk to us at that point. And then it will be another 2 to 3 weeks before baby is seen for the 6 to 8 weeks check. But at that point, if there are any concerns with weight, then we can implement changes. We can look at the feeding. Is it positional? We can also look at if the baby's on formula. How are you preparing the formula? It might be that you're not mixing the formula following the directions on the package. We need to go through that and make sure that the baby is getting as much as baby needs. If there are still concerns with the weight, then we implement a protocol to be measuring and weighing that child, or then we refer on to our our services outside of the health visiting team. So we've got loads of services that we can refer to, and we will refer on to that. So after this visit, we will then be talking about the next contact. We will then be talking about how you contact the health visitors. So we would have been given the health visitors' details, also our helpline. So if you need to ask a question, you can then contact the health visitors helpline, and then you'll be put through to a health visitor. Now, the one thing that you need to note is that health visitors work Monday to Friday, 9 to 5. We do not work on the weekends. So in the case that you wanted to ask a question, possibly you can contact your midwives and ask them the questions to do with baby's feeding until when you can actually contact your health visitor. Do not sit and wait over the weekend thinking, oh, I'll wait until Monday. Please, 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 if there's a concern and you can't contact your midwife, go into the maternal assessment unit for support, because that's what they're there. If the maternal assessment unit isn't accessible, then you need to then go into A&E with your baby if you have any concerns. It is very important that you do that. And then so we will be discussing at the next video, we'll be discussing the 6 to 8 weeks review. Okay, thank you. Bye.